Coach Shelby. Today we're going to be focused on mental health. A little disclaimer at the beginning, we are down a coach today. We have a coach out sick. Coach Stacy, that usually joins us on this webinar, is out today. So this is going to be kind of an abbreviated version of what we wanted to do for you today, but I still think there's a lot of valuable information. This is, I think, our 40th webinar in the past few years, and it's the first one that we've taken the time to do on mental health, and I want to apologize for that because I think we've been ignoring a really, really important facet of our overall health and wellness, and we've been keeping that from you guys, our webinar viewers. So we're going to start to take this opportunity to kind of get this subject out in the open. It's a subject, I think it's becoming more mainstream as people become a little bit more accepting about it and just a little bit more educated, but we want to make sure that you guys are seeing this as a part of your overall health too. So we're hoping to have some future webinars regarding different mental health issues. So if there are topics, just like we're always asking for your feedback, if there are topics specific to this subject, we would love to hear what you want to tell us about. So at the end of the webinar, we'll have our contact information up there like always. But like I said, I want to apologize for not getting some of this information out to you sooner, because it really is important for you, your family, your friends, your loved ones. So today, Shelby and I are going to be talking about addiction and depression. Again, we're just barely scratching the surface today. So bear with us because, like I said, we're missing one of our coaches, but I think it's still going to be a lot of really valuable information. So with addiction, I think everybody's pretty familiar with what that means, but it's a huge issue in our lives. 1 in 4 families is impacted by addiction, whether that means that it's someone directly in your family or it means a friend. 1 in 4 families has dealt with addiction in their lives. And another thing that I think is less commonly known is that addiction is actually a brain disease. Addiction isn't just a weakness of will, it's not a lack of character, it's not that you don't have enough grit to fight this. It's actually something that impacts our brains and our bodies chemically, and so it is something that it has to do with your health, and it has to do with the way your body functions. So with addiction, there are some different terms. Abuse versus dependence are both parts of addiction, and so abuse sometimes is seen as maybe less dramatic. It's kind of like the gateway. It's where your use of a substance, whether it's alcohol, whether it's drugs, whether it's food, whether it's an unhealthy behavior, your abuse of this substance can cause you to do some things you might not normally do if not under the influence. So things like failure to meet obligations. So you're missing important tasks, maybe it's a work-related thing. You're just not staying up on the things that are important to you. It can lead to reckless activities, problems with the law. A lot of times abuse is even just indicative of acting a certain way despite the fact that your family or your partner feel negatively about that activity. So if it's causing problems with your friends, family, if it's causing problems with your job, if it's causing interference with any of your routine day-to-day activities, it's probably a sign that you might be abusing a substance. And then there's dependence, and dependence can mean a couple different things. So physiologically in the body, what happens over time is that this substance, so whether again it's drugs or alcohol or food or anything like that, your body becomes tolerant to that. And so a lot of times we hear this with alcohol. You build up a tolerance. So where maybe you used to take 1 or 2 drinks for you to feel inebriated, now it takes 4 to 5. And as you build up your usage, you need more and more of that. The other side of that physiological reaction is that after that substance is removed, you start to have withdrawal symptoms. Those can range from nausea to headaches to shakes to even just an emotional withdrawal and maybe being a little more aggressive or agitated. That's sometimes a reaction. Even just, a lot of people are familiar with nicotine addiction. If you have ever had a loved one that's tried to stop smoking, you might have recognized that they were a little on edge for a few days. That's a symptom of withdrawal. But then behaviorally, there might be that loss of control. You find it really difficult to stop once you've started. Maybe you go out and you say, tonight I'm going to have 1 glass of wine, but once you start, you exceed that limit that you impose for yourself. Again, you start to spend more time doing this activity than you did doing your other activities. You're avoiding other activities so that you can continue to do these activities. And then continued use despite deteriorating health. I think a lot of us might associate this specifically with smoking. You know, a lot of people have smoker's cough. They start to have issues, bronchial issues, but they still smoke because that addiction is greater than the ability to overcome those health issues. So one of the big things that happens in your brain and in your bodies chemically has to do with dopamine. And there's a lot of different science out there about dopamine. There's a lot of contradictory science about it, but basically what everyone agrees is that it does impact your brain to feel a sense of pleasure. And it's typically associated with a reward from an activity. So not to get too sciencey on you, but basically when you encounter this substance, dopamine, which makes you feel great, is released. And that's what makes you feel good, and that's what people focus on when they talk about the chemical changes with addiction. But here's how dopamine works as far as addiction. So whatever substance, we'll just use alcohol as our example for this. So your use of the substance creates this immediate surge in dopamine. So you feel really good. You feel better than you do when you're just having a good day. So dopamine can be released if you run into a friend on the street that you haven't seen for a while, you get a new book that you've been waiting for from the library. Little things cause these dopamine surges throughout the day, and that's great. You walk away feeling really good. But these substances, drugs or alcohol, can cause this huge release of dopamine. So you feel really, really, really good. But when that is worked out of your system, you experience this huge drop in dopamine. So you went from this extreme high to this extreme low. Well, over time, it's sort of like insulin resistance. It's sort of like people with diabetes become resistant to their body's insulin response. So over time, it's harder and harder to get your dopamine to rise, even just in everyday situations. Like I said, running into an old friend on the street. Now that doesn't cause the same dopamine rise as it used to. So you're at this flatline level until you use this substance to surge that dopamine back up. Well, over time, the more you do that, we know, like I said before, that your body builds up a tolerance. So now to achieve that surge, you're having to use more and more of that substance, and you're having less and less of your regular day-to-day dopamine releases. So that's how you go from maybe a casual user to a chronic user to full-blown addiction, you know, day in, day out. Don't feel like you can get through the day without some kind of substance. So this is, you know, really important when we do talk about the fact that it's not a lack of will. There's some chemical change going on in your body and in your brain, and it's relying on this substance. It's not because you just can't step away from that drink. It's that your body has now shifted your psychology. It's shifted the way your brain chemicals are working, and that's how addiction starts in the brain. But there are a lot of treatment options out there, and that's one thing we want to talk to you about, whether it's you or whether it's a spouse or a family member or just a friend. Talk about these things. Talk about them. You know, there are behavioral therapies available, different counselors and therapists that are trained specifically in addiction. So they're not just a typical counselor. It's somebody that's worked with addiction and wants to help you through the steps that it's going to take. There's short-term treatments that they find are really, really intense and can be really effective, but ideally you want to continue that treatment for life. You want to find those support groups. You want to reach out to your family, talk to them, include them in your sessions. It is really, really important. One thing that a lot of people are doing now, and it's similar to Health Check 360, is using a reward system for helping you to be motivated to make that change. And rather than monetary incentives, they get you out in the community, and so maybe for attending these classes and staying clean, you get 2 free passes to the movie or to an ice skating rink or to a fair. And that way it gets you out in the community, it gets you interacting, gets you in situations where these substances aren't going to be available. And it's a reason to stay clean, and it's also a nice way to get involved with things you might not have seen before during your addictive state. Then there are medications. Some different drugs use different replacement therapies. These obviously are all going to be something to talk to a professional about, to talk with doctors, to talk to treatment centers. There are employee assistance programs. A lot of people, this is like an untapped resource. I know even within my own company, it's something that you just don't even think about, but they are available to you. They're very cost effective. Might be something if, financially you feel like, yeah, I could really use some counseling. I feel like I really could use some help, but I just don't have the, the cash flow to cover that. A lot of times your employee assistance program is there for you. They want their employees to be healthy. They want you to be productive. And so they want to support you. So ask about your employee assistance program, see what your company has to offer, and let them help you. Just some basic things to increase your recovery odds. Obviously, don't use. That's simple. But, it's something you got to remind yourself. Don't use. A lot of times people go through relapses. That's okay. But for, your main message is not to be using if you want to recover from that addiction. Choose from a lot of treatment options. Even if you are doing individual counseling sessions, look for support groups. Include your family. Talk to a number of people, go to a number of places to constantly reinforce what you're working on. Like I said before, involve your family in your treatment. And if you're a family member, get involved. Speak up. Help your family member. But most of all, become an expert in your recovery. Know why you're doing the things you're doing. Talk to your counselor or your therapist or your support group about what it is that you're trying to change and why you're trying to change it. So just to sum up really quick with addiction, and again, like I said, we're pretty abbreviated today, but just talk about it. Talk about addiction with your loved ones. Talk about what you're struggling with and make it known, because like I said, we want to remove the stigma from a lot of these mental diseases. We want to make sure that people are aware that this is something that's out there. Like we said before, 1 in 4 families is affected. So we want you to talk about it. We want you to know about it. We want you to be prepared. Remember that it's not just a lack of will. Remember that for yourself if you feel like you might be addicted. Remember that for your loved ones if you feel they might have a problem. It's not something that's wrong with their character. It's something that's going on chemically in their brain. It's actually affecting their body. So it's not, like I said, it's not something that they can just change really easily, and why can't they just quit? It's something that their body needs to be helped with. Talk about all the options. If you're a family member or a loved one of someone who does maybe have, at this point, just even a substance abuse problem, talk with them and explore some options for them. But most of all, get support. With any of your goals, we talk a lot about exercise goals. We talk a lot about eating changes with a lot of our participants and on these webinars. And we all know how much that support helps with accountability and just with when you feel overwhelmed with the changes that you're making. This is especially important with addiction. Get support where you need it. Get with people that are going to support you in your goals and create environments that are going to be helpful in helping you stop.
All right, let's move on to depression. Very similar to addiction in many ways. It can be a very scary thing, and it's one of those things that we don't want people to know about. We don't talk about it, and people don't seek treatment or think it's something they can just overcome on their own. You should never ignore the symptoms of depression, which we'll get to. They very rarely go away on their own, and you deserve to feel the best you can. And there are also preconceptions when it comes to the causes of depression, just like addiction. People think they are weak and should be able to shake it off. There are ways to lessen your depression symptoms, many of which are lifestyle-based, but depression is caused by a combination of genetic, biological, environmental, and psychological factors. So as you can see here, there's 3 main categories of depression that we're going to cover today. Major depression is the first. This is when the symptoms, again, which we'll get to in a minute, they interfere with your life. You can't function normally, and they become disabling. You can't work, you can't eat, sleep, or even enjoy those activities you once did. Some people might just have a single bout with major depression, but many people struggle with it multiple times throughout their life. The second type we have is dysthymic disorder, or dysthymia, and that's when you have long-term symptoms, usually over 2 years, that may not be quite as severe as that major depression, but it still prevents you from feeling well, and it can interfere with that normal functioning to some extent if you don't get things taken care of, and it can lead to that major depression too. And that third we've got is minor depression. These are symptoms that last for about 2 weeks, but don't meet that major depression criteria again. This is still nothing to ignore, as without treatment, you are at a higher risk for developing major depression if you don't get things taken care of. So a couple other forms that I do want to touch on because I feel like they're relevant to maybe some of us listening here. One is seasonal affective disorder, or SAD. This one is the onset of depression symptoms during the winter months when there's less natural light. So this is more common in areas where winter days are short, say up here in Iowa where we are. Women are also more likely to experience SAD, as well as those who have family members with the same condition. So there is a genetic component too as well. Another form I do want to talk about is postpartum depression. Many women feel those baby blues after having a baby. The mood swings, the crying spells that can feel very overwhelming, but do typically fade. But if you have those feelings and they're not going away and they become more severe, it could be postpartum depression, and you need to do something about it. It's not going to go away on its own. Depression, it's important to seek the help of your doctor right away. The majority of the time they can be treated, and you can get started on that road back to feeling better. So, how does depression affect my body? What are the symptoms? The main symptoms of depression and the various forms are persistent sad, anxious, or empty feelings, feelings of hopelessness, irritability or restlessness, difficulty concentrating, decreased interest in hobbies that were once pleasurable, and then you've got the physical symptoms as well. Increased aches and pains, including headaches, cramps, digestive problems that don't go away with treatments that typically take care of those issues, chronic fatigue, decreased appetite, or it can actually go the opposite way. You can overeat as well. And then same with sleeping. You can either have insomnia or you can have the opposite of that, oversleeping. Depression can also affect the immune system, which makes it harder to fight infection and even can make vaccinations less effective for you. There's also evidence that it can be linked to heart disease, that studies are coming out now with that. So with the major depressions, the symptoms are going to be more severe, and you'll likely have multiple symptoms that are listed here. With the other types, you may have the symptoms, but it may not be quite as severe. You may be able to function normally, but may just not feel very well. Again, no matter what the severity, no matter what you're feeling, if you're not feeling right, go to your doctor and get things figured out. So what are some things that we can do on our own to help those depression symptoms? A lot of stuff, actually. So again, go to your doctor first, get an action plan, but here's some things that you can do to ease those symptoms. First off, we'll talk about exercise. And right away, any form of exercise is going to help. You don't have to do a specific thing. Just get that heart rate up to a moderate level because you want to release those endorphins, which are those feel-good chemicals similar to what Eva was talking about that can actually diminish the perception of pain, similar to morphine. So, I mean, it's natural, obviously. So I think exercise is a great way to start. And we all know the benefits of exercise on the body. And a lot of those effects can help with the depression symptoms, too. It reduces stress. It can ward off those feelings of anxiety and the depression with the endorphin rush that we talked about. It can improve your sleep, which can be tough, which we talked about as well when you're struggling with that depression. Another option to think about is joining a group exercise class. Social support is very important when you're dealing with depression. You need other people to help as well. So this way you get the exercise in, plus you get that social support of friends or make new friends with that class. Something to think about there too. And as you can see, I just added a statistic here at the bottom. A 2005 study showed that 30 minutes of moderate exercise 5 times per week, just getting that heart rate up basically, reduced depression symptoms in people by nearly half in 12 weeks. So definitely something to look into. Next area to look at to help combat those depression symptoms is your eating habits. Eating healthy is extremely important, as we know, again, not only for overall health, but for your brain in particular. Now, there isn't a specific diet to follow for depression, but there are a few things that can definitely help. First off, go whole. Stay away from processed foods as much as you can. Fruits, vegetables, lean meats, all those things that are good for you physically are good for you mentally. They aren't filled with those added sugars. They can raise your blood sugar, and then subsequently you get that crash, which leads to those mood swings, making the depression symptoms worse because you're already maybe dealing with those things and you don't want to exacerbate the problem. Another thing, watch your caffeine. Caffeine can make you feel anxious and nervous. And if you're battling depression, you're already probably feeling that way. Again, we just don't want to make things worse for you. Try eliminating it from your diet for a week or two and see how you feel. If it's not helping, then you can add it back in with moderation. But same with that and the sugars. Try eliminate as much as you can and see if it helps things feel better for you. Another tip, avoid alcohol. Many people who are depressed abuse alcohol, which can lead to that addiction as Eva was talking about, because it helps you forget about your problems in the short term. But as we know, alcohol is a depressant itself and will make those depression symptoms worse in the long run. So avoid that as much as you can. Next one, get enough vitamins and minerals. There's some research that has found that specific things such as omega-3 fatty acids, folate, vitamin D, and vitamin B12 may help fight depression and could be a risk factor for depression if you're deficient in any of them. So naturally, things that you can get these foods in are going to be for the omega-3s, fish such as salmon, albacore tuna, tofu, walnuts, flaxseed, those are just to name a few. Folate comes in various beans, nuts, your green leafy veggies, and that's also fortified in a lot of things like orange juice, but again, we want to get it as natural as we can. Vitamin D, that's kind of tough to find naturally, and we get most of ours from our sunlight, which is a prime reason for that seasonal affective disorder that we talked about earlier. When you're not in the sun, you're not getting that vitamin D. But there are supplements you can take, and you can actually undergo light therapy in the winter if that's an issue for you. Again, talk to your doctor about any supplementation. Vitamin B12, that one's found mostly in animal products like meat, fish, milk, and eggs. You can also take a supplement to those, but again, talk to your doctor before starting anything like that. Next tip, keep a food journal. If you record, write down what you eat and drink, but here's the important part. Write down how you feel after you eat or drink those things. You can maybe find a trend in foods that make you moody or make those symptoms worse, such as the sugars that we kind of talked about earlier. Then after you track and you maybe find a trend, try cutting out those foods and see if it helps with those symptoms that you've got. Second to last one here, eat at regular times. If you eat it with a consistent schedule, it can help regulate that blood sugar again, which can help prevent those mood swings that we already talked about with that sugar increase and then the crash. And find what works for you. Maybe a trial and error thing. It could be eating 3 meals a day is great to help your mood. It could be eating 5 smaller meals. It could be something different. You have to kind of take control and figure out what's going to work best for you. There's no magic pill that's going to work for everyone. So you kind of have to figure it out on your own there. Last one. Invite your friends over for some food. A lot of times you don't feel like eating if you're feeling depressed or you feel like eating junk. So plan to get together with some friends or your family and get that social support while you're cooking a healthy meal. Have everyone bring over something healthy. So talk about some tips there. I'm just going to go through a quick summary as well here. First of all, don't ignore your symptoms. Exactly the same as the addiction. It's nothing that there's biological reasons. There's a lot of things going on. You can't just overcome it. You can't just shake it off. You need help. and talk to your doctor first, of course, and then practice those healthy lifestyle habits to help ease your symptoms. Even if you're not feeling symptoms, healthy lifestyle is just going to help everything. And if you're feeling down, these are the things that are going to help ease those things for you.
Like I said, we do want to get your feedback on this topic, on topics you'd like to see in the future. We're always, working to improve the schedule for you guys, and we want your feedback. But more importantly, like I said, I want you to know that we hope to bring more information like this out for you guys. I apologize again that we haven't made a focus on some of this stuff, and I think it is really important to get out there and get talking about it so that we can overcome it, we can all help each other out. There's more information on eating habits and exercise tips every day, but we rarely find out how to make our minds feel better. So we want to help you with that. We'll open it up for questions now if anybody has any, but otherwise you can check out our blog where we'll have this and any other webinars that we've recorded in the past, and that's just healthcheck360blog.com. You can follow us on Twitter. We're just posting daily tips to keep you feeling good. And then you can also like us on Facebook. So we're posting there all the time too. So does anybody have any questions at this point? Well, it looks like nobody has any questions. If you come up with something later, or again, if you want to provide some feedback, please email us at healthcoach@healthcheck360.com, and we will get to those questions and respond to your feedback. But we appreciate you all. We'll see you on actually the second Wednesday of January, because the first is the new year, so just want to make sure everybody's aware of that. We'll be back on January 8th at noon Central Standard Time for our next